Hello, this is weekly endoscopy seminar from EndoTODAY. Today's topic is autoimmune gastritis and gastric cancer. Globally, Korea is number 3 in the incidence of gastric cancer, both in males and females. However, the incidence of gastric cancer in Korea is decreasing. During the last 20 years, the age-adjusted incidence rate has decreased about 32%. Helicobacter infection is the most important factor for the development of gastric cancer. In a recent population-based study in Korea, Helicobacter eradication decreased gastric cancer incidence and mortality. As Helicobacter pylori seropositive rate is decreasing, interest in Helicobacter pylori negative gastric cancer is increasing. Autoimmune gastritis is a non-self-limiting chronic inflammatory disorder of the stomach. It is characterized by progressive oxyntic mucosal atrophy, nutritional deficiency, and other autoimmune diseases, and development of neuroendocrine tumors and gastric carcinomas. The role of parietal cell antibody in pathogenesis and diagnosis is still unknown. Approximately 20% of patients with AIG are seronegative. It was previously known to be a Western disease that affects individuals of Scandinavian or Northern Europe descent. In this old pathology textbook, I found a misleading comment that it is rare among other ethnic groups. Recent data on global prevalence of AIG is 3.85%. In Korea, history of autoimmune gastritis study is rather short. Just 4 years ago, Professor Sun-Young Lee from Konkuk University reported the first case series of 5 autoimmune gastritis. And the first Korean review on autoimmune gastritis was just published. So it's a really new topic. There has been controversy in the relationship between autoimmune gastritis and gastric cancer. Some autoimmune conditions are associated with gastric cancer. In a US case control study, the odds ratio in pernicious anemia was 1.93, the highest one. Gastric cancer in AIG is often found in older individuals. Tumors are located in the upper body and greater curvature, and the rate of synchronous and metachronous tumors are high. Doctors at Catholic University of Korea evaluated the occurrence of metachronous gastric neoplasms after endoscopy resection in autoimmune gastritis. The presence of AIG was determined using anti-parietal cell antibody. 20%, 20 patients, 7.1% were positive. Autoimmune gastritis group showed significantly higher incidence of metachronous gastric lesions, 45% versus 18%. Based on this curve, they concluded that positive result of anti-parietal cell antibody testing has independent clinical implications for predicting metachronous gastric neoplasms. What is the incidence of gastric cancer in AIG? In a meta-analysis from Beijing, the pooled incidence rate of gastric cancer per 1,000 person year was 1.4. The overall relative risk of gastric cancer was 11. The major limitation is that the role of Helicobacter infection was not analyzed. The relationship between autoimmune gastritis and Helicobacter infection is still controversial. Does it trigger or inhibit gastric carcinogenesis? Is the idea of no Helicobacter, no gastric adenocarcinoma reliable? So the remaining question is that, is autoimmune gastritis alone a risk factor of gastric adenocarcinoma without Helicobacter infection? Data until now is quite confusing. Professor Luge and other prestigious researchers reported their long-term prospective observation. In this study, they vigorously excluded Helicobacter infection by serology, histology, and PCR. In the follow-up period, more than 7 years, there has been no gastric cancer or high-grade dysplasia during the follow-up period. So the authors concluded that autoimmune gastritis has no increased risk for gastric cancer. One of the limitations of the Italian study is that the patient age was just 55 at enrollment. And the other limitations such as lack of serologic testing, rather mild degree of atrophy are a source of continuous debate. The title of the editorial was No Helicobacter, No Adenocarcinoma. One possible explanation is that Helicobacter gastritis makes incomplete metaplasia, while autoimmune gastritis makes complete intestinal metaplasia. Another prospective study from Italy, there was no case of adenocarcinoma in the median follow-up of 52 months. In this study, active Helicobacter infection was excluded. So this study also supports no Helicobacter, no adenocarcinoma theory. However, it is too early to make a firm conclusion. This is a recent histologic and transcriptional analysis in Helicobacter and AIG mouse models. By histology, metaplasia was very similar between Helicobacter pylori and AIG models. And there are many other suggested mechanisms of gastric carcinogenesis in AIG. Based on discussions until now, I can say that autoimmune gastritis has been considered as an important risk factor for gastric cancers. The relative risk is as high as 11. Although controversial, recent studies showed the risk of adenocarcinoma is negligible if Helicobacter infection is strictly excluded. Thank you very much.